Hi, everyone. I'm George Stephanopoulos from ABC News. Our system of democracy is unique. Citizens can influence and ultimately control virtually all of our nation's policies, and for more than 200 years, it has worked. Coupled with our free enterprise economy, Americans enjoy a high standard of living. Countries all over the world have tried to copy us, and tens of millions have flocked to our shores to enjoy our benefits. In this video, we take a look at where we stand as Americans, at how Americans' health and well-being compares to other countries. We're also going to examine the choices we make that impact our health and well-being.
To better understand all this, we'll look at some of the health-related subjects considered by our nation's policymakers. First, we'll look at the percentage of Americans who live to the age of 5 as compared to those in other nations, our access to emergency medical care, and our position in the world in terms of medical research and innovation. We'll also look at the choices that influence our health and well-being, such as drugs, including alcohol and tobacco, cancer, obesity, sexually transmitted diseases, auto crashes, and education and income level. Now you will hear from the person who is helping make this video possible in your area.
Hello, I'm Peter Kelly, CEO of Christ Hospital, a member of CarePoint Health. We hope this film will give you a deeper understanding of our country's democracy and economic system. It is almost impossible to talk about either democracy or the economy without considering healthcare. Our government and our economic system both have a profound impact on our healthcare. And healthcare profoundly influences government and the economy. We all know that medicine and treatment are changing. New drugs, devices, and procedures are saving lives and improving quality of life. The way that healthcare is delivered is changing too, and CarePoint Health strives to be at the forefront of this change. CarePoint Health includes 3 hospitals in Hudson County, New Jersey, and more than 1,000 physicians, nurses, and other healthcare professionals. The future of healthcare is about sharing resources and collaborating across institutions. With the proliferation of new technologies and new procedures, and in an increasingly specialized world, no single institution can provide truly comprehensive care on its own. That's why CarePoint Health combined the resources of 3 established, highly regarded institutions to provide a more complete range of services and specialties to our communities, as well as the latest in medical technology. Another trend that is driving the future of healthcare is preventative care. Doctors, nurses, and other professionals focus on disease prevention and healthcare maintenance. This includes early diagnosis, identifying people at risk of developing specific conditions, immunization programs, and perhaps most important of all, providing counseling and education to make patients better able to manage and improve their health. Preventative care is a cornerstone of CarePoint Health's approach to medicine. The future is also about putting the patient at the center of an increasingly wide-ranging and complex healthcare system that includes physicians, nurses, and other caregivers, as well as a number of facilities and locations, from hospitals to rehabilitation centers to home itself. This means that physicians, nurses, social workers, and others must work together seamlessly to provide coordinated care that takes into account all aspects of the patient's life. In today's wired, connected world, patients want to know that there is a team behind them dedicated to keeping them well. They don't appreciate having to fill in a new form each time they see a new physician, and they want the comfort of knowing all their caregivers have the most up-to-date and accurate information about their health. That's what CarePoint Health is doing, creating 360 degrees of care in which the patient is surrounded by informed, knowledgeable, and compassionate caregivers. Another issue that will shape the future of healthcare is access, ensuring that everyone has access to quality, affordable care. We established the CarePoint Health Foundation to support access to healthcare available for the uninsured and underinsured of our communities. The foundation makes targeted grants to support community health services and increased access to health screening. The future of our nation's democracy depends on a healthy population with full access to quality care. That's why CarePoint Health is focused on delivering the future of healthcare today.
You live in the United States, but you could just as easily live in another country like Chile, Niger, or China. How would your health and well-being be different if you lived in another country? To better understand this, consider the issue of the likelihood of living to the age of 5. Only about 1 out of 100 Americans will not survive until their 5th birthday. In Haiti, in the Americas, 7 won't survive. And in Sierra Leone, in Africa, 19 out of 100 kids won't live to the age of 5. Just living in a country like the United States significantly increases your chances of living beyond the age of 5.
Now let's look at America's emergency medical care. Imagine your friend or family member was injured in an accident. What would happen next? If that person lives in America, he or she will most likely be receiving medical care within a hospital within 45 minutes. That's because nearly 94% of accident victims in America, regardless of their economic situation, are in a clean, well-equipped emergency facility within 45 minutes. Most people around the world are not that fortunate. 85% of the world's population do not live in a high-income country like the United States, and therefore they do not enjoy the same access to emergency medical care that we enjoy. Even in Mumbai, the wealthiest city in the middle-income country of India, only 1 out of 10 accident victims receives transport by ambulance, and nearly 1/3 of all accident victims die due to delays in transportation to medical facilities.
Now, let's hear from an expert on where America stands in terms of medical research and innovation.
I'm Dr. Francis Collins. I'm the director of the National Institutes of Health, NIH, in the United States. I'm a physician, a scientist. I had the privilege of leading the Human Genome Project, and I'm here to talk to you about medical innovation, and particularly the way in which America has played a leading role in that enterprise over many decades. Right now, innovation in medicine is at a fevered pitch. We have the human genome to help us understand how life works and how sometimes disease occurs. And there is a great deal of energy and excitement about innovations around those discoveries to lead us to new ideas about how to prevent, treat, and cure disease. America, the United States, has been in a very remarkable role for several decades because of the investment the taxpayers make through the Congress in supporting medical research. So the NIH, which I lead, is the largest supporter of biomedical research in the world. And the consequences of the work are pretty amazing. If you just want to count up, for instance, publications, more than 1/3 of the publications about medical research right now in the world come from the United States. The development of new medicines, about 1/3 of those come from work done in the US. We could count Nobel Prizes, I suppose. That's a pretty good indicator of where success has happened. 84% of Nobel Prizes are given to groups or individuals that include at least one American. The NIH has supported individuals who won the Nobel Prize now 138 times. But of course, it's also really important for people to take all the right steps themselves to focus on staying well. And it's interesting and somewhat disturbing to notice that 40% of illness in the United States actually comes about because of unhealthy practices that we each choose or don't choose. So as you listen to all of the information in this segment about America's health, I hope you'll both be excited about where it's taking us, the great advances that we're on the cusp of achieving, but also it'll motivate you to make those decisions yourself about diet, about exercise, about other health practices that will keep you healthy for many decades to come. That's our collective goal.
As Dr. Collins said, the United States is a world leader in terms of medical innovation and research. This is in part due to the commitment our democratic government makes to this subject area. With that, and our access to top-of-the-line emergency medical care, Americans live the longest, right? Wrong. America actually ranks 51st in the world in terms of life expectancy. The average American lives to 78 years old. In Japan, life expectancy is 84. Although America is one of the wealthiest nations in the world, we are far from the healthiest. Americans live shorter lives and experience more injuries and illness than people in many other comparable high-income countries. America actually ranks last on all these health and wellness measures compared to the 16 other high-income countries. What do many of these statistics have in common? They're a result of negative choices Americans make. That means it's more likely we won't live as long as we could.
Living in America gives us a far better healthy starting point than most other people in the world. But compared to the other highest income countries, we don't fare so well. Many of the personal choices we make keep some of us from living long, healthy lives. It's a little like being surrounded by the world's most modern exercise and athletic training equipment. That alone does not make us strong, well-conditioned athletes. We have to use the equipment and exercise on a regular basis.
So let's look at 6 topics related to health and well-being, see where we stand as Americans compared to the rest of the world, and examine some of the ways that our personal decisions impact our health on these matters. First, alcohol, drugs, and tobacco. According to a survey, about 27% of American teens drank alcohol during the previous month. The European countries averaged twice the U.S. rate. 24% of Americans over 12 had binged on alcohol in the previous 30 days. That's 5 or more drinks in a 2-hour period. Why is that important? Because binge drinking is especially harmful to the part of the brain which plays a critical role in learning and memory. And alcohol abuse has other unintended side effects: car crashes, unwanted pregnancies. Even one underage drinking or disorderly conduct charge can make it harder to get a job, a car, or a scholarship. And of course, the same negative consequences can happen when you use illegal drugs. Americans use twice as much marijuana as almost every European country. But what about the drugs you find in your medicine cabinet? Prescription drug abuse is a problem in many areas of the world, but they're legal, so many people assume they're safe to use. That's not true. Among American teens, prescription and over-the-counter medicines account for most of the commonly abused illicit drugs. Many incorrectly think, if I take it from the medicine cabinet, how bad can it be? And don't realize how addictive and dangerous these medications are. A drug overdose can happen the first time you take something, and even if you take the same amount that you've taken before. It happens all the time, and it doesn't matter how healthy you are. Few realize that harmful side effects of alcohol and drug abuse can include cancer, liver disease, memory loss, depression, mental illness, heart and respiratory failure, and even death. By now, it shouldn't be news to you that smoking is bad for your health. What you may not know is that it was public policymakers who took actions that drastically reduced smoking in America, such as labeling cigarette packs and banning smoking on airplanes, among other things. Tobacco is the world's leading single cause of death. Cigarette smoking alone is directly responsible for approximately 30% of all cancer deaths in the United States each year. But cigarettes are not the only tobacco products that can negatively impact one's health. 19% of American 12th graders had smoked with a hookah in the past year. Among college students, hookah use is even greater, with 40% having used a hookah. Many don't realize that hookah smoking puts you at risk for the same types of diseases caused by cigarette smoking. According to the Centers for Disease Control, 1 hour of smoking a hookah is equivalent to smoking 100 to 200 cigarettes. So how do Americans compare with respect to cancer? Cancer is the second leading killer of Americans, yet, according to the Centers for Disease Control, at least 1/3 of all cancers can be avoided through prevention and another third through early detection and treatment. Melanoma, a form of skin cancer, is the second most common form of cancer in young adults, ages 15 to 29. A person's risk of the potentially fatal melanoma doubles if he or she has had 5 sunburns at any age. As well, first exposure to tanning beds in youth increases one's melanoma risk by 75%. You can significantly reduce your chances of having cancer by avoiding tobacco, limiting alcohol use, avoiding excessive exposure to ultraviolet rays, eating a diet rich in fruits and vegetables, maintaining a healthy weight, and being physically active, which means trying to exercise 30 minutes a day. As well, having age-appropriate screenings can help prevent cancer, as can certain vaccines. Let's compare the U.S. to other countries in terms of our death rates from cancer.
Technology has improved our lives in many ways, but it can have a negative impact on our weight and fitness. You can order things online without having to go to the store. You can play video games and even see your friends online without leaving the couch. Technology also saves time with pre-packaged and fast food, but that means that Americans are eating more calories and more food with lots of sugar and fat. All of these things impact one's waistline. It's important to remember that being obese or overweight is not just a cosmetic issue. It increases your risk of heart attack, diabetes, and some forms of cancer. In fact, severely obese people die 8 to 10 years earlier than those of normal weight. Healthy eating and exercise can decrease this risk factor. America is one of the most overweight and obese countries in the world. 34% are overweight and 32% more are obese, but fewer than 10% of Italians and French and fewer than 5% of Japanese people are obese.
Okay, how do Americans compare with regard to sexually transmitted diseases, or STDs? Nationally, half of all sexually active youth will contract an STD by the age of 25. Although most STDs are treatable and not life-threatening, they are not a minor matter. They may result in other serious health problems, including infertility, birth defects, increased risks of some types of cancer, and the increased risk of the transmission of HIV. AIDS continues to kill millions around the world, and many right here in the United States. The U.S. has the highest incidence of AIDS among other high-income countries. Let's see how our HIV infection rates compare with other countries.
Hello, I'm Officer Aubrey. You know, I see something on the roads every day that most teenagers cannot wait to get their hands on: a car. Did you realize that the United States has the highest death rate among the 17 wealthiest countries when it comes to transportation-related accidents? In 2012, over 32,000 Americans were killed in fatal highway crashes. 1/3 of those crashes involved alcohol. 16% of those crashes involved distracted drivers who were either talking on their cell phone, texting, or talking to the passengers next to them. Americans also wear their seatbelts less than people in other developed countries. For teenagers, the automobile is one of the greatest threats to their lives. But by driving carefully out there, keeping impaired people from behind the steering wheel, wearing your seatbelt, and most importantly of all, pay attention to all the traffic control devices out here, those things will greatly reduce your chances of dying in an automobile accident. You folks drive carefully out there now.
Finally, let's look at one additional topic that can literally change your life and your long-term health. As you have seen, there are a large number of different steps you and your fellow Americans can take to have a healthier life. But health experts agree that two issues, education and income level, will most impact your chances of living a long and healthy life. America has the highest poverty rate among the 17 high-income countries. If America's overall health is to improve, so must its overall education and income level for its poorest citizens, focusing them on the steps that lead them out of poverty. Did you know that the life expectancy of a 25-year-old American who dropped out of school is 9 years shorter than one with a college degree, and that a college graduate on average earns $1 million more over a lifetime than someone with just a high school diploma? A very important new discovery by the Brookings Institution found that even modest education is a path out of poverty and into improved health. It determined that young people can virtually assure that they and their families will avoid poverty if they follow 3 elementary rules of success. 1, complete at least a high school education. 2, work full-time. 3, wait until the age of 21 and get married before having a baby. People who follow these 3 rules have only a 2% chance of living in poverty and a 72% chance of joining the middle class, defined as a family income above $55,000 per year. So, in summary, where do we Americans stand with respect to our health and well-being? On average, we are better off than the vast majority of the world's people. In fact, as an American, You have a life expectancy rate at birth that is better than 90% of the world's population. Even Americans that are among the poorest 10% of our population have a life expectancy rate that is better than 60% of the people in the world. But remember, American health is no longer the best of the best. Among the 17 wealthiest countries, America now ranks last in the areas of health previously mentioned. And unfortunately, the trend indicates that our rank in the world in terms of health will fall farther and farther. You can do your part to reverse this and make America and yourself healthier by making many of the lifestyle changes mentioned in this video. You will now hear from the person who is constitutionally elected by the people from your part of the state to represent your interests regarding health and other important issues in our nation's government in Washington, D.C. As your representative in the U.S. Congress, it's the responsibility of Congressman Albio Osiris of the 8th Congressional District of New Jersey to deal with national issues of importance to our lives and to our country, including the issue of your health and well-being. The information you have received from this videotape gives you a very good example of the kinds of issues which your member of Congress deals with in Washington. His job is to study such issues and try to make sure that any action our government may take on issues like health care improve the lives of the people in the area that he represents, as well as those in the rest of the nation. As always, he looks forward to hearing from you on this or any other subject.
So where do you stand as an American? Each one of us is provided with a whole lot more than most others in the world. Our standard of living here makes us among the lucky ones, and with the right choices, we can enhance our health.